My name is Jason Hines. I'm CEO and co-founder here at Gigasheet, and I'm joined by Garth Griffin, our CTO.
Hi,
Garth, you want to
everybody.
give a quick intro to yourself?
Yeah, my background is the tech side. So I was at Google and then worked with Jason together in cybersecurity. And now we're here. So coming from all things programming, all things tech, that's me.
Yeah. And as for myself, my background has been in software really my whole career. I started in defense and national security as a software engineer. I worked at Google for a while. I worked for some analytics companies. I got into sales. I worked in cybersecurity for about a decade. And then for the last 6 years, we've been working on Gigasheet together. We've been working on the price transparency problem pretty much since the data came out in 21 and 2022. The data really wasn't very usable at that time, but over the years, it has become primary focus of our business, and the data is quite valuable and useful today. We're going to talk about the latest in our evolution here at Gigasheet. We're going to introduce Price Transparency Explorer, our latest capability, and we're excited to share that with you today. As a quick agenda, why even bother? Why do this? We're going to introduce the product capabilities. We'll do a live demo and walkthrough. We'll show you several of the key features like maps, benchmarking, and also plan comparison capabilities. We'll do that live in the real product. Not afraid to put that out there. We'll see how it goes. Live demos always successful, but I think it'll be great. And then we're happy to do a Q&A and take questions if there are any. So with that, let's dive into it. So why really even bother with this? Well, price transparency data, as I mentioned earlier, came out in 2021 for hospitals, and for payers, the transparency and coverage rules came out in 2022. And especially for payers, these files are massive, complex files. They can be spread across thousands of different files. It's really not very usable, certainly not by consumers anyway. There are still lots of inconsistencies, although new regulations have really helped, as well as enforcement have helped with that. A new schema came out and for payers February 2nd, and we're excited for that data. There are additional enhancements coming, probably looking for new data to be added around 2027. CMS is still working on finalizing the rule adjustments for that. But a big reason why do this, the existing databases that are out there today with this data often leave more questions than answers. And frankly, that's really what's out there are databases, but the data can be conflicting and it's hard to understand what you're looking at. And that's often because some assumptions have been made about the data ahead of time, and you can't really always see what's going on behind the scenes. And that's a major challenge, especially when you want to analyze the data, and that's what's needed to make sense of it. And that typically requires a significant IT investment in resources and/or time, infrastructure, and so forth. So the whole idea behind our company has always been, to make data more accessible to people who aren't data engineers or maybe don't have a team that they can dedicate to this problem. And you really shouldn't have to. This data is still really messy and complicated, and we're not ashamed of that. We'll show you what exactly is in there. It's not perfect, but that doesn't mean that there isn't signal within that. And, throughout my career, a lot of what I focused on is finding that signal in the noise, whether it's working in defense and national security after 9/11, or working with Google on search, or in cybersecurity. A lot of it is looking for that signal within these massive amounts of data. And Gigasheet got pulled into this business within healthcare. And it turns out that the technology we've developed is really powerful for solving this problem.
I gotta say, from the data perspective, I mean, I've worked with a lot of data sets. I was data scientist before I was at this company, and every data set has problems. I mean, that's just a fact. That's just a fact. Any real world data set, toy data set's clean, but any real world data set, you're gonna find, weird things in it, things you have to deal with. The trick is, what do you do? How do you get real insight out of it? And that's what we're all about.
Right. Like, if you're trying to have this data tie out to the exact penny, it's going to be difficult to do, not impossible. But that doesn't mean it's not valuable and there isn't signal in here that can be used and useful for the healthcare market. This is a little bit about what we do at Gigasheet, we collect data from hospitals and payers nationwide. We extract and transform that data to make it human readable from machine readable. We enrich it. We do a lot of normalization and add provider details and entity resolution as well. Then we apply benchmarks. We add, for example, Medicare adjusted rates, as well as analyze the data. And that's really what we're going to focus on today are these last two steps. And we're going to talk about the analysis. Not going to talk about all the issues upstream of that. Happy to dive into that. And really, the culmination of this work is we've listened to what people want over the last year or so, and we've packaged it up into an interface that makes it easier to analyze this. We've made tweaks and adjustments to preparing the data, really leveraging AI on the back end to make it easier to work with and just vastly, faster to get to answers. So we're going to take a look at a price map, which is a visualization over a map that lets you take a look at prices, services, density in various geographies. We're going to take a look at some benchmarking. So if we want to look at a provider or organization and see how they compare to the broader market. We'll take a look at that. And then finally, we'll take more of a self-funded self-insurance look at the data, looking at how to compare plans. So if you're a self-funded employer, broker, or benefits partner or consultant, this is probably interesting. And we'll talk more about this self-funded tax as well. So that's kind of a high level agenda before we get into it of what we're going to look at here today. Anything on your end to add while I kind of get this fired up here?
I think this is going to show the power of data visualization. I mean, I think it's awesome to get the raw, and I think depending on your background, you might be able to make really good use of that if you're comfortable working with a database or comfortable working with large files in a processing pipeline. Well, that's how you kind of get, if you want to call it like the full enchilada. But what data visualization is great at is letting you spot trends right away, or maybe using it as a tool while you're kind of, maybe this data is not your main thing because you work in network development, or you're in some kind of negotiation process and you don't really want to spend a ton of time getting through every last, entry in this data. You want kind of the high level picture, spot some trends, and then afterwards drill in as needed. So I think, to me, that's what's really exciting about the visual presentation.
Yeah, no, that that's great. So, and as Garth mentioned, we're kind of going to look at this from different perspectives. There are multiple use cases for this data, from payers to providers, plans as well, and even within life sciences, med tech, and of course self-insurance, self-funded plans. So we'll touch on each of those. But just to start, this is an introduction to Price Transparency Explorer. Obviously, there's the map here, and I've highlighted Texas. So we're going to just start with a very kind of basic exploration. Here we'll choose a specialty. I've chosen general practice, but as you see here, there's a list of all the taxonomy codes that are available in this data set. And to start, we're just going to pick a billing code, 99214, typical office visit. I'm not going to narrow the payers down. I'm going to look at all the payers that are available. And we're going to leave on our smart rate capability as well, which helps remove outliers and other rates. So here, after I hit apply filters, you can see the data is populated on the map with these markers. And you'll also see some of these clusters with numbers in it, indicating that there are more providers in this area. And if we zoom into that, we can see it. So obviously, lots of rates in Texas here. It's a big state and has lots of providers. We can remove the prices on the map to just get a better look at density, to see kind of where most of the providers are. Not surprising, Dallas-Fort Worth area has a high concentration of healthcare providers, particularly in this case, general practice providers. So what we'll do here is just drill into this data and take a closer look at what's going on here. So this is obviously the Dallas metro area. Lots of general practice providers, lots of different rates. And as you saw, I can click on these to get a sense for how many providers are in this locale and what their median rates are for an office visit. And there's a pretty wide spread. You can see, 93, 88, $78 all the way up to over 100 or 130. Let's take a look at some of the data behind this because really, this gives us a high level sense of what's going on, but we also want to take a look at kind of what's going on behind the scenes here. So what this is doing is aggregating and fetching data from Gigasheet behind the scenes. And we're going to dive in and show you the raw data as well as this aggregated view, which is helpful. But when you want to dig deeper, you need to see all the details. And I'll show you exactly what I mean. So in this case, there are two providers in this particular zip code, and we can see their rates aren't too far apart, but let's dive into this provider here and take a deeper look at their details. Now, obviously, this is fetching data from a much larger data set, and I'm going to dive into that and show you exactly what it is. Actually, the way we do that is using this tab here, which is Deep Dive in Gigasheet. And this is the master data set underneath the covers, kind of behind the scenes here that will load up as well. And this is still going. So this is popped in here. We can see we have rates for Blue Cross Blue Shield, United, Cigna. There are a whole lot of rates here, which is kind of a little odd, you might think, because these are, I mean, how many rates do you need for a single office visit in this case? And that's really where we want to drill into the underlying raw data in Gigasheet. So this is basically a spreadsheet that's powering this whole visualization layer. And we can see here it's got almost 2.8 billion rows. So this is effectively a sheet of all the rates for all the providers across and all the payers across Texas. And this has, when I click that blue button, it took us exactly to the data that was powering that particular table and that marker I selected on the map here. And if I scroll to the right, we can see all the details. And we were looking at Scott. So let's just narrow our search to Scott Knepper. I don't know who this individual is, but we're going to use him as an example. I notice a lot of people, when they talk about price transparency data, they aren't really showing you the real results and what's in it. But all this data is public. There's nothing secret anymore. It's just hard to access and hard to get to. So there's nothing proprietary in here. These are the publicly published negotiated rates, Medicare rates, and details from the provider registry that are in here. So I filtered this down to just Scott. It's 50 rows of data. And I'm still curious, why these are all 99214 office visits. So why is it there are 50 of these? Well, if I scroll to the right, I can start to see why here and here. So there are multiple EINs associated with these contracts. One reason is simply that we can see there are a variety of payers here. So we've got Blue Cross, United, Cigna. But in addition to that, we've got different organizations and we have different plans that are associated with it. All these things can affect pricing in addition to things like modifiers, which there aren't any for an office visit, but there are certainly different places of service. So you may think, well, office visit should be in the office, which is places service code 11, but it's possible that a patient evaluation is really what this is, a patient evaluation. And this could be in an emergency room setting, for example. So if I aggregate this data and get a better look at how this rolls up, we can see here there are the various groups. This isn't that uncommon, especially with someone in general practice. In this case, I actually did Google this individual, and they're an emergency room physician. So they work at various different clinics, maybe urgent cares or emergency rooms. And we can see here how many rates they have at each. And then probably what we want to do is just take a median on the fly of these so that we can see how they compare. So what I'll do is select the negotiated rate and select the median here. Could do the similar or same for Medicare percentage to kind of get a sense for maybe reference there against Medicare, what the negotiated rates are like for this. So this will take a second and calculate this and provide the data. So we went from nationwide down to Texas, down to the Dallas Fort Worth area. And now we're just looking at this individual provider here. And we've calculated their median negotiated rates for office visit. We can kind of see here that Century Integrated Partners, this organization, has the strongest reimbursement rates here based on these codes. So that's a quick look at just how you can use price transparency, the price map, to dig into this data and take a look. Let's zoom out and change gears a little here and take a look at another discipline. In this case, let's just flip over and look at orthopedic surgery, for example. Instead of, I could do office visit again or patient evaluation. Let's do something more like a surgery. This is CPT code for total joint replacement. We can see here, again, wide variety of rates on the map, anywhere from $1,400 to $3,300, just kind of eyeballing it here. And we can definitely see that there are trends out, as you go downtown, not surprising, more expensive, but then there are some lesser rates out here. And if we dig into some of these, we can take a look at it. So here we see there are 69 rates and 7 providers in this case. Give this a second to load here. So in addition to individual rates, we also have organizations like this Alpha Orthopedic Physician Group you can see here. We could drill into their rates as well, but let's flip over and benchmark these guys. So this says, for this total joint replacement, their rate is more moderate at $1,400 as opposed to some of these others in their immediate vicinity that are higher. So we're going to flip over to this benchmarking workbench. And this is useful for both providers if you're looking to benchmark yourself or a group of competitors, or if you're a payer or working on network development and you kind of want to know, well, what are the going rates? Maybe we're expanding into this market and we want to understand what kind of rates are out there. So here I've entered a single NPI. I could enter multiple NPIs. Some organizations have more than one. In this case, I'm just going to select orthopedist. So this is who I want to benchmark alpha orthopedics against. And you could choose other specialties as well. Back earlier when we were talking about general practice, maybe I want to include things like pediatrics or family medicine in addition to that, or multi-specialty, for example. I might want to include other groups. In this case, I'll keep it simple and just choose orthopedics. I'll pick a basket of codes. These are just highly utilized codes we see often for orthopedists, some E&M codes, and then I'll keep the total joint replacement as well. In this case, we default to a market area with a zip 3. So the first 3 digits of the zip code, which is typically a pretty good measure for a metro area. We could change this and we could zoom out effectively by using a zip 2. We could go all the way to the zip 5, which would be hyper local, or we could go statewide and look at the entire data set. For this, I'll just keep zip 3. There's a good density of providers and orthopedists as we saw on the map, so I'm not worried about that. I will not limit this by payer, but I could. Here, I'm just going to let it run across all the payers in the market, but if I really was interested in one of them, I could limit it to that. As for volume, I'm not sure how many of these patients they see a year, but I'm assuming it's more than 100. I'll just say 1,000. I don't know if they're doing 1,000 total knees a year or total joints, but this can be tweaked and accordingly. Obviously, if you're the provider, you know about how many patients you see a year. And if you are a payer or self-funded employer, claims volume is probably. So this will run for a couple of minutes and should build a benchmarking report for us that compares this particular orthopedics group to the broader market.
While that's running, tell you guys a little bit about how we do smart rate. It's an interesting thing. I think it's a sort of our AI driven way to try to give you the most relevant selection. So you could imagine this whole demo that Jason's been doing, we could have widened out that aperture by letting in even things that we didn't classify as smart rate, but we think it's a really useful way to narrow down to the rates that are actually going to be sort of the typical way or a more standard way that people do procedures.
Yeah, exactly. It just helps us weed out the irrelevant data points that are often found in this and just focus on kind of what's most relevant. Of course, you can always get back to all the data. One of our principles is not to hide anything that's in these data sets really, or at least not to alter it, I guess I should say. And we keep all the relevant details and then we'll enrich it or embellish it and add detail to it, but we won't abstract the detail away so that it turns into just like a black box and you're not sure what you're looking at. So this report finished. It took a while. There are 139 orthopedists in this zip 3 that we were able to get rates for. For these 3 codes, they are paid under market at alpha on the aggregate. Some are at market rates, and we'll dive into it. We could go into Gigasheet and get all the raw data. We could also dump it to a CSV to analyze in a spreadsheet, but let's just look at it here and see what the results are. For example, here's the difference between their on the total joint replacement on the whole, they're about 8.4% below market. That's actually pretty attainable or should be. We know negotiations generally don't shift rates more than about 5%. So this is simple math here that you can see, and it's not hard to calculate that, but it can add up to real money, even if you were to just even if you were able to just move your rates 5% here in either direction, whether you're from the payer perspective or from the provider perspective. Rates are here. You can see this one is not significant really, but United and Cigna are. And if we just look at the ENM codes here, they are also following roughly the same trend, more or less, which is common. It would be somewhat unusual to negotiate a contract based on just one billing code or something. So this basket of codes gives us a good sense of where this provider stands in the market with each of these payers. So that's how we use the benchmarking capability in Gigasheet. I'll pause there and then I'll flip over to our map view again, and we're going to take a look at the self-funded employer kind of perspective. But if you have questions along the way, you can definitely put them in the chat and we will come to those at the end of the session. So I'm just going to clear this out and then we're going to move over to Virginia and take a look at some other data. Let's look at obstetrics and gynecology. So this is more from that self-funded, self-insured, or benefits partner angle. Obviously, everyone is born at some point in their life. So this is often a concern for employers, especially if they have a workforce where they're having babies, and it can be very expensive as well. So what I'll pick here is this highly utilized code, which is actually ultrasound. And we'll take a look at this data for Virginia. Now, for Virginia, we're only looking at Aetna plans in this case. I limited it to that. And we're still using our smart rate filter here, but I could take that off and look at all the rates, including potential outliers as well. So you can see here, again, the density of where most of the rates are and the prices as well. And we'll drill into the Washington, D.C. area here and just take a look at some of this data. As you can tell, as we get closer in the metropolitan areas, as we get closer to DC here, get a bit more expensive. But what I'm going to do now is you may have noticed this toggle at the top, which is compare with Athena Consulting. Athena Consulting is a company with a self-funded plan, and we just pulled that plan. It's publicly available. So we were able to pull their plan down. Turns out their plan was sold by Cigna. And what we can do is compare these Aetna rates with their Cigna plan and see what they look like. So if I toggle this on and then hit apply filters, now you can see the markers have changed. Some of them are red, green, and yellow, and you can tell by this legend down here what that indicates. So if the rate is higher with the self-funded plan, it will be in red. If it's lower, it's green. And if it's yellow, it's about the same. And you can see there's a lot of red here. And in some cases, it looks pretty different. For example, 147% increase is significant. We can also, by clicking into this, start to get a sense for the difference in these networks. Now, we're really not comparing apples to apples because Athena Consulting, with their self-funded plan, they're not paying premiums the way you would with a fully funded plan. So you can't really say like, oh, it's a lot more expensive because you have to account for those premiums. And that's where modeling comes into play. But even at a high level, we can very quickly see kind of the differences. For example, the Athena Consulting network with Cigna looks very strong with 41 providers in this area versus only 15 providers in the Aetna network. We can drill into this data as well. We can also go to all the underlying data in Gigasheet and take a look at it. It's also easy to flip between plans. So we could load up multiple plans and say, compare the self-funded plan that Athena Consulting has with another self-funded plan by what we should really do is look at the self-funded plan that Aetna offers and pull one of those and then start to compare that way. But you can see here that when we dig into the data, it tells more of the story here, where some of these providers are actually a lot cheaper in the Athena Consulting self-funded plan than they are in the Aetna plan, but some of them are very expensive. This is where care navigation and steering people to high quality care becomes important because we can definitely see here for an ultrasound that there is quite an array of people even within the Athena network. So not even comparing across plans, but just looking at it that way. So lots of different ways to visualize and use data in Gigasheet's Price Transparency Explorer. And we could, of course, even zoom out and do this statewide as well and drill into a different part of the state where we might have people. But it gives you a sense for kind of what we're building at Gigasheet and how it's coming along. And we're really working to make this data just a lot more accessible to more people. And I think that's what it really comes down to.
I think what's so exciting about the plan comparison to me is that if you imagine that you're shopping for a self-funded plan, sort of shopping for that product, it can be really hard to kind of discern uh, the trade-offs between different options there. But if you have a standardized benchmark, which is what this price transparency gives you, that's what you'd want to compare against. And then in this Gigasheet visualization, you can put them side by side and get that sort of delta, that difference, that comparison point presented visually and get a really quick sense for, the Athena Consulting option A versus option B if you were to run two different plans against that benchmark. So I think that's just a really, that's a really powerful capability that's kind of a step beyond just having access to the rates. To really do that comparison and see that visually can be a really, really nice way to evaluate products.
Yeah, it's a lot easier to explore something visually than it is to just like look at it. Yeah, especially a table of data because spreadsheets are awesome. I mean, our whole back end and a lot of our user interface, as you saw, is based on the ability to pivot and filter huge data sets. But it's really hard for us as humans to understand, a billion data points. But when you aggregate those up, those several billion data points into a map and dots on the map, it starts to make more sense. Historically, a lot of this work has to be done by code or analyst or analytic workflows. And our goal is to just make that much, much faster or provide interactive kind of speed of thought ability to query, pivot, dig into the data, export it if needed, and move on. And really, the analysis that used to take months to do things like plan comparisons now takes a few minutes. You have to get the data selected correctly. And I think we were talking about this the other day, Garth, like data selection. What was it that you said? It was like, is
You
always
ask
the
any
hardest
data
problem.
scientist, ask any
Yeah.
data scientist whether the majority of their time is spent on the fancy math and the statistics and the, making the pretty picture out of it. No, any data scientist will tell you it's 80% or more of their time is just data preparation. Find the data source, get the data in, get it into one shape, remove all the crazy garbage that's always in there from somewhere. But typically, that's the bulk of the work for any sort of data analysis task. And then once you have some data, then you can go and do sort of the fun part and do the math and so on. So, having this data, prepared in this way is a huge boon.
For sure. So, as I mentioned, there are a lot of different angles. There are a lot of different ways people use this data today. And really, the whole goal behind price transparency is to try to help give ultimately consumers better information, but also help. The thesis is that more transparency in this historically opaque market will drive better competition. And so, whether you're negotiating on the side of a provider or a payer, you should expect that the people on the other side of the table are absolutely going to be using this data. Or even if you're selling medical devices or are building a network, that this information will be used by your competition. So you should expect that going into those negotiations. We're going to be, speaking of price transparency, we're going to be at this Self Insured Institute of America Healthcare Price Transparency Forum later this week. So if you happen to be there, we'd love to talk to you and answer any questions you have. We'll be showing this stuff live, and it should be a good event there, and certainly warmer, hopefully, than where Garth is in Boston, where
Love
I
your
am also Washington, D.C. So, yeah, with that, we're happy to answer any questions that you may have. Early access is available now for customers. But yeah, I hope everybody enjoyed it, and thanks for joining. Let's see. I'll head over to the Q&A panel now to see if there are questions. So one of the questions is, can payer files be uploaded into the Price Transparency Explorer to read the data? Hopefully that was somewhat answered, but I'll answer it explicitly. Yes. So all the data we looked at is from payer data. Typically, the way it works is we have our data repository of data that's prepared for nationwide for all the payers across the country, and that we can tap into that. So, but if you have your own like payer file, for example, an employer plan, or maybe a very specific regional plan, or whatever it may be, yes, it can be loaded. And the way I didn't show the configuration options, but the way the Price Transparency Explorer works is it points to one of those sheets in Gigasheet, and it acts as a visualization layer on top of that. Is the demonstration going to be available for review after the session? Yes. If you join the session, you should receive a recording afterwards, a link to this recording, which you can share with others. We'll also be posting it on our website as well, and we'll follow up with an email also in about a week as well. But since you're attending, you should get a link to the recording right after this is over. There's another question we got earlier that I'll let you talk about, Garth, since I'm tired talking. API. Do we have an API, and is it available to generate these visualizations? How does that work?
Yeah, we have an API. So let's imagine that you did some great analysis that you loved in that visualization, but you have some flow, some workflow at your company that you know you're going to repeat over and over. That would be a great kind of use case for our API, where really anything that you do with that data, that spreadsheet full of data, anything that you can do in there, filtering it. Jason did some groups, he computed some statistics, all the stuff that kind of drives that visualization. All of those things can be done with an API. And so we have people running automations with our software at this company to sort of support workflows at their company. So yeah, absolutely. We can support API use cases.
Here's another question. Besides rate by rate comparison, can the tool compare providers or plans in aggregate by applying utilization? Um, and Chris asked that question. And I guess I had some follow-up questions. Maybe you can type the answer or I'll make some assumptions. Do you mean if you have utilization data, like from claims, or are you asking if we provide utilization? A second to answer. And then maybe I'll just answer both.
I think we do have a nice feature in the visualization tool for if you have some utilization numbers. When Jason was showing the benchmark, that you can sort of put in, there's an input you can put there for your utilization to get a better estimate of kind of the actual dollar amount difference. So that's one way. Like if you're showing up with a number, you have some utilization data internally to your organization. That's a way that you could apply that in the visualization tool.
Yeah. He followed up and said either applying some standard utilization or custom. Yeah, absolutely. You can do that. So it can be done in different ways. One is in the visualization capability itself. The other is by adding a column on that sheet that we saw where we would map in utilization, and we could weight by that.
I'll also note that the smart rate feature does incorporate sort of something like utilization rates. So that, and that's just a binary switch. So that's just on or off. But utilization is a really great way to get to like, hey, do people actually do this in this setting with these like, is this actually a procedure that's happening in these circumstances? So we do incorporate utilization in that sense, but it's just on off. So that's a little
Yeah, it's
different.
just very high level. But yeah, we could absolutely apply custom weighting to it as well. That's a good question. And worth noting that the price transparency CMS rules that are open for comment right now are discussing adding utilization to the data. Jeff asked, does it allow for hospital rate comparison by DRG? Yes, I just used CPTs in the example. There are a lot more CPTs in the data in general than DRG codes. DRG codes are absolutely in here. And if we filtered instead of looking at like general practice or obstetrics, and looked at general acute care hospitals and then chose DRG codes, we can absolutely look at it that way as well. It said just one clarification there. Does it allow for hospital rate comparisons by DRG? It's still based on payer data with what I showed. We also collect and prepare and analyze hospital data. That is not what I was showing in the platform today. So you could look at what the payers publish as the contracted rates with the hospitals and DRGs. Doesn't mean it can't be done with the hospital data. Just want to be clear about that. Let's see. Do looks like one more question. These are great questions. Happy to answer more if you have them. So you mentioned AI, and how is that being used? That's a fair question. It seems like everything's like AI all the time. One is, and I'll let Garth talk a little more about this. Like we use AI very extensively on the back end. We feel like we're doing this work much more efficiently than it's been done in the past with some clever techniques. And then we also have some capabilities as well, which I didn't show today, but maybe should be the topic of another webinar, that are more on the front end. But Garth, I'll let you talk about kind of the back end and the data. If you think about that pipeline I showed with all those various steps, a lot of it goes into the preparation work so that you can very quickly assess the data.
Yeah, we try to have a good balanced approach. So for things that are kind of more cut and dried, we just program it. It just, we have rules, we have our own sort of internal things that for example, like ruling out clinically implausible, things like that, just put those out with no AI needed. But there's a lot of stuff in this data that it has more nuance, it's sort of like, well, sometimes you could do it here. And so we can sort of use AI to make that step of the processing, a little more robust to whatever kind of weird reporting these payers might be providing in this data. So as part of the data preparation, it's really it's a really useful tool for us. And we think that it's, leads us to generate a higher quality data set. There's also, like Jason mentioned, there's some AI sort of tooling on the front end, which that's kind of like personal taste. Some people, they like don't want to trust it. They don't want to ask their question. They want to just get click the buttons, type the numbers. Other folks really like to have that sort of interactive experience. You've probably seen it in other products. So on the front end, it's kind of optional. But I think on the back end side, the data preparation, it really does help us kind of deal with the sort of more nuanced aspects of the data that we're working with.
Yeah. I mean, separately, we've developed an AI agent that can analyze this data and use these tools. And that's where it becomes really cool because let's say you want to do some comparison across hospitals and you have utilization data and you want the agent to incorporate that in addition to what it's seeing in our product. That's where it becomes really powerful. And we've been able to produce some really compelling results there, kind of a fraction of the amount of time that it typically takes to do that kind of comparison.
I'll say our one principle that we really try to hold to is that the AI shouldn't be modifying the rows. So, there might be a selection, or maybe, is also incorporated in the smart rate where that's a selection that you can toggle on and off. But we're not going to sort of have this, it's not going to be transforming, if you want to call it that, transforming individual rows. So you're really getting the row is in the file, somewhere in one of those many, many files in the terabytes of data, the row's in the file. It helps us present it in a more usable way.
That's it. That's it for the questions, I think. Thank you for that. And we're happy to answer others. If you're interested, reach out from our website, gigasheet.com. And there's a big button there for request a demo, we'd be happy to talk to you more.
Thanks, everyone.